This year, the city, the state, even the CDC confirmed what so many of us witnessed firsthand. New York City's communities of color were hit hardest by the pandemic. Now, State Senator Kevin Parker says by declaring racism as a public health crisis, we'll find a systemic solution to a long-time systemic problem.
I think now is the time to start pushing the envelope on these issues.
From acts of violence in communities of color,
The number of Black men that you see being killed by the hands of either gunfire in the streets or by police,
to the increased risks of diabetes, asthma, heart disease, and dying in childbirth.
when we talk about racism, that this is not a figment of Black and Latino and Asian people's imaginations, that this is a actual real thing.
Last month, the American Medical Association recognized racism as a threat to public health. And now State Senator Kevin Parker is proposing a new bill that would require the state health department to declare racism as a public health crisis.
Establishing a working group to look at solutions and start implementing them through our state government.
Matthew Shapiro of the National Alliance on Mental Illness explains racism doesn't just have an impact on physical health.
It's almost like a dark cloud hanging over you.
The magnitude of racial health care disparities was brought to the forefront this year by COVID-19.
One of the places where it immediately played out was on the availability of testing.
Ahead of the distribution of a coronavirus vaccine, National Urban League President Mark Morial has joined a new task force here in New York of Black leaders. They're working to educate and help break down the distrust some may have of the vaccine while fighting for fair access.
The most vulnerable, those at greatest risk, should be entitled to receive the vaccine the earliest in the process. Now, we know that that includes many people in the Black community. Well, you have to meet people where they are.
And members of that task force say they don't want to see people waiting in long lines for hours in underserved communities waiting for that COVID-19 vaccine. They're pushing for community-based distribution in areas like schools and houses of worship. Reporting from the Soundview section of the Bronx this evening, Ayana Harry, Pix 11 News.